The provincial government announced back in August that safe consumption sites in Ontario that are near schools or childcare centres will have to close in March of next year. Now, 5 of those sites are in Toronto, and a new study finds that hundreds of people will lose access to potentially life-saving services, which could have dire consequences.
Those people are going to be at higher risk for overdose, higher risk for death. So most likely people who don't have another place to go are going to inject in alleys, in parks. We're going to have more public injecting, and we're going to have more overdoses.
Dr. Ahmed Bayoumi, the lead author of the study, explains they found that on average in 2022, more than 1,300 people used Toronto's supervised consumption and treatment sites every month. Of them, an estimated 561 used the sites that are slated to close.
And those people count for tens of thousands of injections over the course of a year. Right. So we're talking about many, many unsupervised injections.
Dane Kent from the Regent Park Community Health Centre says the numbers from the study help to quantify the impact of the province's decision.
And this will provide irrefutable evidence to the broader public to understand the implications of the CTS closures.
Along with people losing a vital entry point to other support and rehabilitation services, he points out the potential impact on the broader healthcare system.
You know, if you look at the number of EMS calls for overdoses in 2023 in Toronto alone was 4,500 and a few. And in that same year, over 3,000 were managed by CTS. So we're seeing now potentially 7,500 to 8,000 overdoses a year being managed solely by the EMS. That's going to delay ambulance response times.
Bayumi says the study also points to the need for better planning as well as help for the sites that do stay open to increase their capacity.
So that might mean more staffing, it might mean more money, it might mean longer hours, but we need to do something to actually address the gaps that are going to be introduced into the system by this policy. This decision was introduced without really any way to accommodate the clients who are going to lose access.
The province says they will be opening 19 new homelessness and recovery treatment hubs, and the safe consumption sites that are closing have the option to convert into these hubs. In a statement, a spokesperson for Health Minister Sylvia Jones said in part, hubs will reflect regional priorities by connecting people with complex needs to comprehensive treatment and preventative services, including mental health services, addiction support, primary care, and supportive housing.
More funding for the care of people who use drugs is a great thing. But restrictions on that funding don't make sense. We need funding for people across the entire spectrum of drug use, people who are still using, people who are thinking about stopping, and people who have stopped. And the way the Heart Hub funding is being rolled out, it's only for one part of that population, and it's really leaving another huge part of that population without any services.
Now, the province says the 19 Heart Hubs will be opened by or before the closure of the safe consumption sites. For City News, I'm Dilshad Burman.